Hi everyone, today we're going to be talking about professional role transition as a new grad. Reports suggest 31 to 65% of newly graduated nurses leave their profession within the first 2 years of entering professional practice. Further evidence claims that 67% of those new nurses experience extreme levels of burnout and express a desire to leave their profession altogether. Walk into the video with us to explore the anticipated professional role transition of a new nurse utilizing Dr. Judy Duksher's grounded theories of transition shock and the stages of transition. Brittany here is a fourth-year nursing student who is currently preparing for the NCLEX and is excited to graduate. After graduation, Brittany will find herself in a transition from being a student to being a fully responsible, accountable, professionally practicing nurse. Dr. Duksher's professional role transition theory can be discussed in 3 stages. The 3 stages are doing, being, and knowing. Prior to graduation, Duksher emphasizes that it is important to take time to explore the reasons why you decided to pursue a career in nursing, how your reasons may have changed throughout your education, and lastly, how your reasons may be challenged or supported by the role you anticipate pursuing upon graduation. The day has finally come. Brittany has officially graduated with a degree in a Bachelor of Science in Nursing. Duksher states this reflection will help prepare you to practice in an area that aligns with your expectations. For example, if you enjoy working in high-intensity, rapidly changing situations, an acute care setting in the hospital may be your initial practice preference. If you like to teach, develop programs, or provide international healthcare relief, you may want to consider a community, public, or international placement. After graduation, you would probably think it's all sunshine and roses, but this isn't always the case. Regardless of where you choose to nurse at the start of your career or what role you take on as a new nurse, there are always certain elements of becoming a nurse that are common to the majority of graduates. As you can see, Brittany passed her NCLEX and is now a registered nurse. She was hired on a medical unit, and the change from student to professional comes with additional or different pressures, expectations, and challenges, as we will demonstrate in the following clips. Let's talk about stage 1, doing. This occurs 3 to 4 months post-grad. Within this stage, new grads experience what is called transition shock. Transition shock is a term that embodies the elements of the first 1 to 2 months following orientation into the workplace. Transition shock speaks to the extent of the initial struggle, which can occur anywhere from 2 weeks to 2 months to adjust to a new reality. Transition shock is normal for new graduates to experience. Transition shock has 4 dimensions: physical, emotional, socio-developmental, and intellectual. Brittany is experiencing all 4 of these and overall having a difficulty coping with the challenges in being a new grad. The physical component of transition shock is when she's sleeping on the job, and the emotional aspect is when she is visibly upset and eating ice cream in bed. The socio-developmental dimension of transition shock occurs when the new nurse is uncertain and lacks proper guidance. This is shown through Brittany's inability to delegate tasks to other nurses, which results in the frantic state that you see here. Brittany experiences the intellectual dimension through her inability to answer a family member's complex question regarding the health of their loved one. Ultimately, this demonstrates Brittany's lack of knowledge and incapacity to relay information. Struggling to adjust to increasing responsibility in her new role, Brittany arranges to meet with the nurse educator for her floor. Brittany expresses the challenges that she is facing in her new role related to workload, questioning her knowledge and ability, and finding it difficult to manage her responsibilities outside of work. The educator listens to Brittany and remembers a perfect resource that was given to her for newly graduated nurses. The resource is a book written by Dr. Duksher titled From Surviving to Thriving: Navigating the First Year of Professional Nursing Practice. The educator reminds Brittany that she is there for any further supports that she needs. On her break, Brittany starts to read through the book given to her by the educator. The book discusses transition shock, which Brittany resonated with. She continued to flip the pages and came across Dr. Duksher's professional role transition and discovered the 3 stages as discussed earlier: doing, being, and knowing. The beginning of stage 1 correlates with your first shift working independently since graduating, where you feel the full weight of the clinical workload. Duksher believes every new nurse will experience each process of doing. The processes include learning, performing, concealing, adjusting, and accommodating. Learning focuses on the discovery of different work reality than what the new nurse envisioned and a discovery of what you don't know. The performing and concealing processes speak with the challenge to perform skillfully and on time without killing someone, while concealing your anxiety from coworkers. Adjusting refers to the task of managing multiple unstable patients and multitasking, which can cause new grads to constantly feel as if they're missing something or inadvertently bringing harm to someone under their care. Finally, accommodating occurs when trying to meet deadlines. New nurses may accommodate practices they see in more experienced staff without critiquing those practices themselves. After reading through the first section, Brittany came across some tips that can support her transition as a new nurse. She requested that she be assigned a consistent preceptor for the next couple of months and if the educator would serve as a mentor to her. Stage 2 happens between 4 to 8 months of the first year of practice. Transition crisis occurs during this stage, generally 6 to 7 months post-grad. During transition crisis, a new nurse may experience different thoughts such as searching for a work-life balance, questioning why they became a nurse and why they are feeling undervalued in their workplace, doubting whether or not they chose the right career path and considering quitting or switching jobs, and examining the difference between the student and the new grad role. And lastly, revealing is where a nurse reveals what they do not know, which can further encourage teaching and learning opportunities. As shown in the videos, Brittany is doubting herself and struggling with what seems like simpler nursing tasks, such as drawing up medication, programming IV pumps, and setting up a sterile field. There are other factors that contribute to this state, such as lack of proper support and trust from the senior nurses, the pressure of time, and overall lack of confidence in oneself. Being able to have separation between nursing and everyday life is key, and can be done through having hobbies and passions outside of work. Finding a hobby can help reduce stress in the work week and allow for a mental breather. Exercising can be a way to spend time taking care of yourself and find balance. Brittany has chosen to take up the hobby of working out, helping to separate her work life from her home life. Stage 3 is ongoing throughout the entirety of a nurse's evolving career. In this stage, we see Brittany exploring and establishing who she is as a nurse, also known as regrouping. She becomes confident in her nursing skills, understands how her practice is influenced by her personal values, accepts that there's no such thing as perfect practice, and recovers the passion and love that she once had for the profession. Remaining content in your nursing career involves taking care of yourself too. Self-care is a simple way to make time for yourself and relax. Brittany has chosen to take time for herself by indulging in a relaxing evening with a face mask and drinking her favorite tea. Let's go back to some tips and tricks that Brittany used to help with the stress of the professional role transition. In Stage 1, Brittany went and talked to the educator, feeling comfortable enough to ask her to undertake the role of being her new mentor. In Stage 2, Brittany adopted the hobby of exercising to balance her home life and her work life. Finally, in Stage 3, Brittany took time to perform self-care practices. Oftentimes, these tips and tricks are easier said than done, but important to incorporate to ease the transition and mitigate the stressors of being a new grad nurse. It is important to highlight that there are other tips and tricks as outlined by Dr. Duksher. However, these are the ones that Brittany found work best for her.